Hi, my name is Josh, and I'll be documenting my process of getting a dental implant and a sinus lift at Pacific Dental in Tijuana, just south of San Diego, California. My first time south of the border for dental care was in 2008. In the late 90s, I'd had 2 crowns done on my front teeth. Those crowns, they lasted 10 years and they started to fail. And when I asked my California dentist what I could do about it, he recommended an implant for $4,500 each, so around $10,000. So I started to research what my other options were. And I went down to Pacific Dental, and the doctor there, he did 2 crowns and did 2 root canals. Again, re-root canal the teeth, and then did 2 crowns. And that was in 2008. And now it's 2018, so they've been there for 10 years and they've worked. I haven't had any problems with them. I don't have any pain, and they look pretty good. Here you can see those 2 crowns. This tooth that I'm having work done on this time, I had a root canal on in my early 20s, 20 years ago, and it was worked fine until recently it started to get infected, so it had to be extracted. And it was, it's a top molar, and because it was root canaled, it lost bone in that area. So that's why I need to do a sinus lift on that, if I want to do an implant, because there needs to be enough bone that so the implant has a secure foundation. You can see the missing tooth, and the surrounding teeth have started to drift. On the other side, without the gap, you can see the teeth are closer together. Hi there, doctor. Maybe you could just tell me your name and what you do.
Okay, my name is Adrian Mora. Mainly in Pacific Dental, I do implant dentistry, oral surgery, sinus lift procedures, wisdom teeth removal, multiple extractions. That's mainly my focus here in this practice.
And could you describe when is a sinus lift needed?
Okay. Sinus lift is needed, for example, in certain cases, people already have a sinus lift depressed, okay? So if you're missing a tooth, the sinus moves down, and we have an absence of bone. And in order to place a dental implant, we must create bone by lifting the sinus, and that way we can place a dental implant. So that's basically what it is. We create bone in the sinus.
Right. Could you briefly describe the process of getting a sinus lift? What's involved?
Sure. There are 2 techniques that we can apply. One is a lateral approach, and one is an internal or crestal approach. Okay. Both of them are techniques to lift it, but we prefer more to do laterally when there's a huge absence of bone, when the patient hasn't had any teeth there for a long time, or crestal when you do have between 3 millimeters and 5 millimeters of residual bone. So those are the 2 techniques that we can apply. Both of them are very predictable when the surgeon has been trained to do these techniques.
And where did you do your dental studies, or how long have you been doing this type of work for?
Okay. I've been doing this kind of work almost 10 years now. I graduated from general dentistry in the Baja California Autonomous University, and then I went for postgraduate studies in Massachusetts for the International Academy of Dental Implantology. That's where I learned how to place implants, how to do the surgical procedures, and I did CE courses continuing education courses in Harvard, Tufts, and various continuing education courses from different implant companies.
Great.
So this is the panoramic x-ray. You can actually see all of your teeth, and now we know where your sinus are, okay, especially the area where we're going to do this procedure. And we can make an outline right here, where the bone is, where the base is, and we can actually have an estimate of how much of a bone we have. So for example, in your case, we're looking at between 3.5 millimeters and 4 millimeters. Okay, so based upon your x-ray, you have between 3.5 millimeters and 4. Okay, so if everything is ideal and the surgery is going to be predictable, we can place the implant at the same time that we do the sinus lift. So this is our plasma machine. So basically, before we do this, we actually numb the patient, then we draw blood either from the right arm or the left arm, between 3 or 4 vials depending on what the patient needs. And then we just place them inside here. And you can get plasma rich factor, either liquid or membranes, and we can everything obtain it through here. Okay, very fast, very predictable, and the advantages of using plasma is that it's from your own body, so less % of it getting rejected or infected. Joshua, are you ready for your procedure today?
Yeah, I'm a little nervous, you know, because I never had dental surgery before, but I'm happy that I'm here and getting it done.
Perfect. You don't need to be nervous. We call it surgery because we're actually going into the area of your bone. We need to lift the membrane carefully, but you're in good hands. It's very predictable when you know what you're doing. Okay. So for example, in your case, probably we can place the implant at the same time if everything is okay. If your bone accepts the implant, it's going to be predictable. We place the implant, and then in 4 to 6 months, depending on how well we place the implant, how stable it is, you can come back, take the impression, and have your crown. Worst case scenario, your bone is softer than normal. We only lift the membrane. We wait between 3 or 4 months. You come back, and then we do the implant then. But it's very simple. We would do local anesthesia. We would give you painkillers. You will not feel anything during the whole procedure.
Great.
Okay, that's it. Everything turned out great. Okay, we were able to do the sinus lift and to place the implant simultaneously. What we call primary stability, it means how tight I placed the implant was good. It was 14 newtons per centimeter. In theory, we could place a crown on top of it, but for the integration process, we still need to wait in order to take the impression and place a crown. Okay, we've done our part. Now it's your body. We have to let it heal. It's going to take between 4 to 6 months. Okay, at that time you can come back and take the impression. This is before we placed the implant, before we did the sinus lift. As you can see it very well here, the red outline. This is where your sinus used to be. Approximately, like I said, 4 millimeters of bone. And this would be the after. You can see the outline of the new bone right here. Okay? So we are going to know that the implant is ready to be loaded once this line disappears and the new line forms right above here. Okay?
Thanks very much, doctor, for your time. Appreciate it.
No problem. You're very welcome. I'll see you between 4 to 6 months in order to take the impression for your crown, and everything will work out good.
Good.
All right.
Thanks.
You're welcome.